The emergency department at San Diego Naval Medical Center hummed with the controlled chaos of a Saturday night at 0300 hours. Lieutenant Sarah Chun moved between trauma bays with practiced efficiency, her sneakers squeaking softly against polished floors as she assessed the steady stream of routine cases. A Marine with a dislocated shoulder occupied Bay 1, while a sailor with chest pain waited in Bay 3 for his cardiac workup. Nothing unusual, nothing that quickened her pulse after 8 months working these overnight shifts. Chin finished updating the Marine's chart when the overhead speakers crackled. Attention all trauma personnel, mass casualty alert. 6 critical inbound, gunshot wounds, estimated arrival 4 minutes. All available personnel to the emergency department. The announcement cut through the normal noise and conversations stopped mid-sentence throughout the unit. Her hands moved before her mind fully processed the words. Chin spun toward the supply corridor, calling out assignments as doctors and nurses emerged from break rooms and offices. Dr. Williams, take trauma 1. Martinez, you have 2. Kelly 3. Respiratory therapy to all bays. Pharmacy, push the massive transfusion protocol. Her voice carried that particular quality of calm authority that made people move without question, a tone she had learned years ago in very different circumstances. The trauma bays transformed in 90 seconds. Equipment carts rolled into position for lines prepared, monitoring systems activated, blood products arriving from the lab in coolers that techs positioned beside each bed. Chun surveyed the organized chaos she had orchestrated and allowed herself one steadying breath before the ambulance bay doors burst open. 6 stretchers rolled in simultaneously, each surrounded by moving bodies in desert camouflage. The faces of the men pushing the gurneys wore the particular tightness Chun recognized immediately, the expression of operators who had just lost control of the situation and hated every second of it. SEALs, she noted, reading the insignia and the way they moved. Training accident at the nearby base, someone said, but the wound patterns told her otherwise. These were combat injuries, real ones, and the story about training would change by morning once the public affairs officers got involved. The SEAL in front, a lieutenant by his collar insignia, directed his team with sharp hand signals. Stay with them, he ordered, pointing to different stretchers. We do not leave our brothers. His jaw set in a way that suggested he had already decided this was non-negotiable, and Chun felt the familiar weight of an incoming confrontation settling across her shoulders. She stepped forward, positioning herself between the lieutenant and trauma Bay 1, where the most critical patient needed immediate attention. Your team needs to clear the treatment area now, Chun said, her tone professional but firm. We cannot work around you. The words came out matter-of-fact, a simple statement of medical reality rather than a request. The lieutenant's eyes flicked to her scrubs, to the absence of a white coat, to her nursing identification badge. We stay with our brothers, he repeated, his voice dropping into a register that probably worked well on junior enlisted but meant nothing in her trauma bay. His 2 teammates, sergeants judging by their insignia, moved closer to their lieutenant in a display of unified front. By the way, which state or country are you watching this from? Drop a comment below and let me know. The patient on stretcher 1 made a sound between a cough and a gasp, the kind of noise that meant seconds mattered more than protocols or territorial disputes. Chin moved past the lieutenant without further discussion, her focus narrowing to the young petty officer whose lips were turning blue. His chest wall moved asymmetrically, the right side lagging behind the left in a pattern she had seen too many times before. Tension pneumothorax, she announced, reaching for his neck to feel for tracheal deviation while her other hand palpated his chest wall. The signs confirmed her assessment in under 5 seconds. Chest tube kit to Bay 1, she called out, but her hands were already moving through the preparation sequence. The patient's oxygen saturation dropped from 89 to 83 while she watched, his respiratory rate climbing past 30. There was no time to wait for the attending physician to arrive from wherever Dr. Williams was currently managing another critical patient. Wait for the doctor, the SEAL lieutenant said, stepping closer. You're just a nurse. The words carried that particular emphasis on the last word, the dismissive tone that reduced her role to something beneath his concern. His sergeants shifted position, creating a wall of camouflage and disapproval between Chun and her patient. Chen's hands never stopped moving. She swabbed the chest wall, located the intercostal space by touch, and inserted the needle for emergency decompression while explaining her findings in the calm, clinical voice she used for teaching moments. Decreased breath sounds on the right, hyperresonance to percussion, tracheal deviation, oxygen saturation dropping, respiratory distress increasing. Tension pneumothorax requires immediate intervention or patient expires. The needle slid home and air hissed out under pressure, that distinctive sound of a life-threatening condition being resolved by correct action at the correct moment. The patient's lips shifted from blue toward pink in the time it took the lieutenant to process what had just happened. His oxygen saturation climbed back to 91, then 94, his respiratory rate beginning to slow as his chest wall expanded properly again. Chun held pressure on the catheter site and made eye contact with the respiratory therapist who was already moving forward with the proper chest tube equipment for the definitive treatment that would follow her emergency intervention. Dr. Williams appeared in the trauma bay entrance, her experienced gaze taking in the scene in one sweep. The attending physician saw Chen's hand position, the needle decompression site, the patient's improved color, and gave a single nod before moving past to the next critical patient in Bay 2. That nod contained everything that mattered. The professional acknowledgement that Chun had made the right call at the right time and saved the patient's life in the process. The three SEALs exchanged glances, something passing between them that Chun did not bother to interpret. She had more pressing concerns, specifically the massive hemorrhage developing in Trauma Bay 2, where another petty officer was bleeding from what looked like a femoral artery injury. Chun handed off her stabilized patient to the respiratory therapist and moved to the next crisis, her mind already calculating the pressure points and the equipment she would need. The patient in Trauma Bay 2 was losing blood faster than the 4 lines could replace it. Corporal Hayes, the name tape read, though Chun focused on the bright arterial spray pulsing from his upper thigh rather than his identity. The femoral artery had been nicked, probably by shrapnel judging by the irregular wound edges, and the field dressing applied by his team had slipped during transport. Every heartbeat sent another surge of red across the white sheets. Chen's hands moved to the injury site with the kind of precision that comes from muscle memory rather than conscious thought. Her fingers found the exact pressure point where the femoral artery ran close to the bone, that specific location 2 inches above the wound where directed force would compress the vessel against the pelvic structure and stop the hemorrhage. She pressed down with exactly the right amount of pressure, not so much that she would damage the artery further, not so little that blood would continue escaping. The bright red spray stopped immediately. From his position near the trauma bay entrance, Lieutenant Morrison watched Chen's hand placement with the focus of someone whose training had taught him to recognize small details that mattered. His eyes narrowed slightly as he observed the angle of her fingers, the specific positioning that matched a technique taught in advanced combat medicine courses rather than standard nursing school. Something flickered across his expression, a moment of cognitive dissonance between what he expected to see and what he was actually witnessing. Dr. Williams arrived at the bedside, carrying a surgical clamp kit that she had grabbed from the supply room during her transit between patients. Chun began speaking before the attending physician could ask questions, her voice steady despite the awkward angle required to maintain perfect pressure on the artery. Femoral artery laceration approximately 2 centimeters superior to the inguinal ligament, active arterial hemorrhage controlled with manual compression at the standard pressure point. Pulse is strong distal to my hand position, suggesting the vessel is not completely transected. Recommend immediate surgical clamp placement followed by vascular surgery consult. Williams positioned herself opposite Chun and opened the clamp kit with practiced efficiency. The attending physician's hands moved into the wound space while Chun maintained pressure, their movements coordinated through the kind of wordless communication that develops between experienced trauma providers. "Guide me in," Williams said, and Chen did exactly that. 2 millimeters inferior, she directed. Another millimeter. There. The clamp closed around the damaged vessel, and Williams locked it into place. Chen slowly released her pressure, watching for any sign of continued bleeding, but the clamp held perfectly and the hemorrhage remained controlled. The overhead alarm from Trauma Bay 3 cut through the focused intensity of the moment. "Patient in full arrest," someone shouted, and Chun heard the distinctive flat tone of a monitor showing asystole. She glanced at Hayes, confirmed that his bleeding remained controlled under Williams's management, and made the instantaneous decision that emergency physicians learned to make about where they were needed most urgently. Williams caught her eye and nodded once. "Go," the attending physician said. "I have this one stable." Lieutenant Rodriguez was the patient in arrest, and Chin processed multiple pieces of information simultaneously as she moved into position at the head of the bed. The monitor showed asystole, the classic flat line that meant no electrical activity in the heart. His chest showed the signs of significant trauma, with multiple penetrating wounds visible across the anterior surface. The respiratory therapist was already bagging him, but getting minimal chest rise. Chun called out the code protocol, while her hands assessed his chest wall, feeling for the telltale signs that would explain why a young, fit operator had suddenly lost all cardiac activity. His chest felt wrong under her palms, a kind of mobility that should not exist in a rib cage. "Multiple rib fractures on the left side," she announced, and then her fingers found a crucial detail. Subcutaneous emphysema tracking up toward his neck, which meant air escaping into the tissue spaces from a pneumothorax that had likely progressed into something worse. Penetrating cardiac trauma cannot be ruled out, Chun continued, her assessment delivered in the rapid-fire cadence of someone who had made life-and-death decisions under much worse conditions than a well-equipped trauma bay. "This patient requires emergency thoracotomy." The words created a moment of absolute silence in the trauma bay. Emergency thoracotomy meant opening the chest cavity right there in the emergency department, a procedure reserved for the most desperate situations when a patient would die in the time it took to transport them to an operating room. It was also a procedure that nurses did not perform, a bright line in the hierarchy of medical interventions that separated physicians from all other providers. Chin's hands were already moving to position Rodriguez properly while she called out equipment needs. "Thoracotomy tray to Bay 3 immediately. Betadine prep. I need a number 10 scalpel and rib spreaders ready the moment I finish the prep." Her voice carried absolute certainty, the tone of someone who had done this before and knew exactly what the next 47 seconds needed to contain. Sergeant Vasquez, one of Morrison's team members, leaned towards Sergeant Porter and spoke in a voice pitched low, but not quite low enough. "How is a nurse running 2 codes?" The question hung in the air for just a moment before Morrison's sharp gesture silenced any further commentary from his men. The SEAL lieutenant's expression had shifted from skepticism to confusion, his previous certainty about the proper order of things cracking under the weight of watching Chun manage multiple critical patients with a competence level that did not match his assumptions. The thoracotomy tray arrived, and Chun prepped Rodriguez's chest with speed that prioritized thoroughness over perfection. She made the incision in a single confident motion, the scalpel cutting through skin and muscle layers to expose the rib cage underneath. Her hands positioned the rib spreaders and began opening the chest cavity while calling out each step for the benefit of the trauma team surrounding her. "I am entering the pleural space now. Significant hemothorax present, evacuating approximately 800 milliliters. Pericardium appears intact, but I am making the pericardial window to confirm no cardiac tamponade." The entire procedure took 47 seconds from first incision to the moment Chin's gloved hands carefully examined Rodriguez's heart and found it still attempting to beat despite the massive insult to his system. She initiated internal cardiac massage while simultaneously directing the team to push medications and prepare for potential internal defibrillation. The monitor began showing organized electrical activity again, weak and irregular, but present. Rodriguez's blood pressure registered on the arterial line for the first time since his arrest. The trauma bay filled with the sounds of equipment, alarms shifting from critical warnings to merely urgent ones. Morrison stood in the observation area outside Trauma Bay 3, his tactical mind processing information and arriving at conclusions he did not want to accept. He watched Chen's hands performing internal cardiac massage with the practiced precision of someone who had done this before multiple times under conditions that probably made a well-lit trauma bay seem comfortable by comparison. The pressure point technique on Hayes had been advanced combat medicine. The emergency thoracotomy had been battlefield surgery. The calm management of multiple simultaneous critical patients had been the performance of someone with extensive trauma experience beyond what any standard nursing role provided. His eyes tracked to her uniform for the first time since the patients had arrived, looking for details he had dismissed earlier as irrelevant. Her scrubs covered any ribbons or insignia she might wear, and her nursing badge showed only her name and credentials without additional information. But something about the way she moved, the absolute confidence in her medical decision-making, the combat medicine techniques she employed without hesitation, all pointed toward a background that did not match the simple category of nurse he had assigned to her. Chen stepped back from Rodriguez as the cardiothoracic surgery team arrived to take over his care. Her scrubs were covered in blood, her face remained calm, and her hands already reached for the next chart because there were still 3 more patients who needed assessment, and she had been away from them for too long. Morrison watched her move past him without acknowledgement, her focus entirely on the medical mission rather than on the 3 SEALs who had dismissed and obstructed her efforts to save their teammates' lives. The clock on the trauma bay wall read 0412 when Chen finally stepped back from the last patient chart. All 6 casualties had been stabilized and transferred to the intensive care unit, where surgical teams would handle the definitive repairs their injuries required. 4 hours into her shift, and she had already used more adrenaline than most overnight shift demanded in their entirety. Her hands were steady as she completed the documentation, noting each intervention with the precise military format she had learned years ago and never quite abandoned despite working in civilian nursing roles. The nurses' station provided a brief refuge from the controlled chaos of the trauma base. Chen pulled up the electronic charting system and began entering the detailed notes that would allow the next shift to understand exactly what had happened and why she had made each critical decision. Her fingers moved across the keyboard with practiced efficiency, translating the past 4 hours into medical terminology and timestamp sequences that would become part of the official record. Morrison approached from the hallway with the careful steps of someone who was not entirely certain of his welcome. He stopped at the edge of the nurse's station, his camouflage utilities still marked with the blood of his teammates, his expression containing something that might have been uncertainty. Chun registered his presence in her peripheral vision, but continued typing, allowing him to wait until she reached a stopping point in her documentation rather than immediately acknowledging his presence. "Where did you learn to do a thoracotomy?" Morrison asked when she finally looked up from the computer screen. The question came out more direct than smooth, lacking the social preamble that might have softened the inquiry into something resembling normal conversation. His eyes remained fixed on her face with the intensity of someone conducting an intelligence assessment rather than making casual conversation. Chen's expression remained neutral as she considered how much information this question required. "Navy taught me," she said after a moment, the answer technically accurate while providing minimal detail. Her hands returned to the keyboard, a clear signal that she considered the conversation concluded and had more important tasks demanding her attention. Morrison did not move away from the nurse's station. His tactical mind was clearly processing information and arriving at conclusions that require verification. "The Navy teaches standard hospital corpsman training," he said, the statement phrased as fact but containing an implicit question. "That training covers basic trauma care. What you did tonight was not basic trauma care." Chun saved her documentation and closed the charting window before responding. Her eyes met his directly for the first time since he had approached, and something in her gaze suggested that she had answered these kinds of questions before and found them tedious. "I have additional training," she said simply. The words provided no specific details about what that training entailed or where she had acquired it. Dr. Williams emerged from the staff break room, carrying 2 cups of coffee, and intercepted the conversation with the timing of someone who had been observing from a distance and decided intervention was necessary. "Lieutenant Shun," she said, using the rank for the first time that Morrison had heard it spoken aloud. "Can I speak with you privately for a moment?" The attending physician's tone made it clear this was not actually a request, despite the polite phrasing. Chun stood and followed Williams into the break room, leaving Morrison standing at the nurse's station with new information that reconfigured everything he thought he understood about the past 4 hours. Lieutenant Chun, not Nurse Chun. An officer, not enlisted. Someone whose rank actually exceeded his own by a step, which meant his earlier dismissal of her authority had been not just medically inappropriate, but also a violation of military protocol. Inside the break room, Williams handed Chun one of the coffee cups and gestured toward the small table that served as the staff's refuge during overnight shifts. "I need to ask you something," Williams began, her voice carrying genuine curiosity rather than interrogation. "Your techniques tonight were exceptional, but they were also unusual for standard nursing practice. Can you tell me about your background?" Chin wrapped her hands around the coffee cup and allowed herself a moment to decide how much truth this situation required. "I was a hospital corpsman before I became a nurse," she said, starting with the foundation that explained some, but not all of her skills. "I served with Marine units during multiple deployments overseas." The statement provided facts without elaboration, a professional summary that left significant gaps. "Which Marine units?" Williams asked, her medical curiosity now fully engaged. "And how many deployments are we talking about?" Chin took a sip of coffee before answering, buying herself a few seconds to consider the question. "First Marine Division," she said finally. "For deployments total, 2 to Iraq and 2 to Afghanistan. I worked in battalion aid stations and forward surgical teams, treating combat casualties under field conditions." The explanation came out matter-of-fact, describing experiences that had shaped her clinical judgment in ways that no amount of stateside training could replicate. Williams absorbed this information with the expression of someone suddenly understanding previously confusing data points. "That explains the combat medicine techniques," the attending physician said. "The pressure point control, the field thoracotomy, the way you manage mass casualties without hesitation. You learned all that downrange." Chin nodded once, acknowledging the assessment without expanding on it. She had learned to keep her combat experience compartmentalized, something that belonged to her past rather than her present. The emergency department offered enough challenges to engage her skills without requiring her to constantly reference the worst days of her life as credentials. In the hallway outside the break room, Morrison stood with his back against the wall and processed the fragments of conversation he had overheard through the partially open door. First Marine Division meant infantry units, the tip of the spear where combat was most intense and casualties most severe. For deployments meant multiple years in war zones. Battalion aid stations and forward surgical teams meant she had been treating traumatic injuries under fire while his team had still been in basic training. Sergeant Vasquez approached Morrison with the careful body language of someone delivering information their commander would not want to hear. "Sir," he said quietly, "I checked with Chief Ramirez about hospital corpsman training. He said standard corpsman school does not cover independent thoracotomies. That is battalion surgeon level training or special operations medicine." Morrison's jaw tightened as another piece of the puzzle fell into place. Special operations medicine meant she had not just served with Marine units, but with their most elite elements. It meant her training had included advanced procedures specifically designed for situations where no surgeon was available and someone would die without immediate intervention. It meant everything he had assumed about her based on her nursing scrubs and her gender had been catastrophically wrong. Porter joined the conversation with additional information gathered from his own inquiry. "The hospital corpsman raiding on her uniform," he said, keeping his voice low. "I saw it earlier, but did not think about what it meant. If she is a lieutenant now, and was prior enlisted as a corpsman, she would have had to earn a commission somehow. That usually requires exceptional performance or special programs." The three SEALs stood in the hallway and confronted the uncomfortable reality that they had dismissed, obstructed, and disrespected someone whose credentials likely exceeded their own in the specific domain of trauma medicine. Morrison's mind replayed his earlier words, particularly the phrase, "just a nurse," and recognized them now as the kind of assumption that got people killed in actual combat situations where expertise mattered more than expectations. Chen emerged from the break room and found the three SEALs clustered in the hallway. She registered their presence with the same neutral expression she had maintained throughout the night, neither acknowledging nor ignoring their obvious discomfort. Her path took her past them toward the supply room where restocking needed to happen before the next potential emergency arrived. Morrison opened his mouth to say something, then closed it again without speaking. No words seemed adequate to address what had happened tonight, and his tactical judgment told him that an apology offered in exhaustion and shock would carry less weight than one delivered after proper consideration. He watched Chen disappear into the supply room and made a decision that he would need to learn considerably more about Lieutenant Sarah Chun before their next conversation occurred. Morrison's barracks room at Naval Special Warfare Group 1 offered no comfort at 0630 hours when he finally returned from the hospital. Sleep evaded him despite the exhaustion that made his muscles ache and his eyes burn. Every time he closed them, he saw Chen's hands moving with absolute precision through procedures he had dismissed as beyond her capability. The cognitive dissonance between what he had assumed and what he had witnessed created a mental itch he could not ignore. He gave up on sleep at 0700 and headed to the team room, where his men were already gathering for their scheduled debrief about the previous night's incident. The official story called it a training accident during a live fire exercise, which was close enough to the truth for public consumption. The actual story involved classified operations parameters that would remain buried in reports he would spend the next week completing. Chief Petty Officer Ramirez was already in the medical bay when Morrison found him, organizing supplies with a methodical precision that made him the most trusted medic in the group. Morrison leaned against the doorframe and watched his senior medical specialist work for a moment before speaking. "Tell me about hospital corpsman training," he said without preamble. "Specifically, what procedures they learn in standard school versus advanced programs." Ramirez looked up from the supply inventory he was conducting and gave Morrison the kind of look that suggested he knew this question had a specific origin. "Standard corpsman school covers basic emergency medicine," he said, setting down his clipboard. "They learn floor placement, basic airway management, wound treatment, medication administration. It is solid foundational training, but not surgical level." "What about thoracotomies?" Morrison asked. "Or advanced hemorrhage control using pressure point techniques?" Ramirez's expression shifted from professional interest to genuine curiosity. "Those are not standard corpsman procedures," he said carefully. "Emergency thoracotomy is typically battalion surgeon level or higher. The specific pressure point control you are describing sounds like special operations combat medic training. That is an entirely different program that requires selection and months of additional education beyond basic corpsman school." Morrison absorbed this information and added it to the growing list of data points that did not fit the simple category he had tried to force Chen into. "Where would someone get that level of training?" he asked, knowing the answer would confirm what he had already begun to suspect. "Special operations units," Ramirez said. "Marine Raiders, MARSOC, sometimes conventional units with surgical support teams attached. But mostly the advanced independent procedures. Those are reserved for medics who will be operating in small teams where no surgeon is available and evacuation might be delayed." He paused, clearly connecting dots in his own mind. "Why are you asking about this?" Morrison considered how much to share about the previous night's events and decided that his senior medic deserved the full context. "The nurse who saved Rodriguez's life last night," he said. "She performed an emergency thoracotomy in the trauma bay. She also used pressure point control to stop a femoral bleed before the surgeon arrived. Her techniques were not standard nursing protocols. Ramirez set down his supplies entirely and gave Morrison his full attention. That nurse was not just a nurse, he said, the statement landing with the weight of professional recognition. Someone with those skills served downrange in a combat medicine capacity. Probably multiple deployments based on the confidence level you are describing. Morrison returned to the administrative office and logged into the Navy personnel system with his standard access credentials. He typed in Chen's name and watched the basic service record populate on his screen. Lieutenant Sarah Chun, current assignment Naval Medical Center San Diego. Previous assignments included Naval Medical Center Portsmouth and Naval Hospital Okinawa. The overseas postings suggested operational experience, but the details remained frustratingly vague. Her rating showed hospital corpsman, confirming what Vasquez had observed on her uniform the previous night. Her rank showed 03, a lieutenant with approximately 6 years of commissioned service based on the dates listed. But several sections of her record displayed the dreaded phrase, access restricted, in red text where details should have been visible. Morrison's 03 clearance was insufficient to view significant portions of her service history. Morrison's barracks room at Naval Special Warfare Group 1 offered no comfort at 0630 hours when he finally returned from the hospital. Sleep evaded him despite the exhaustion that made his muscles ache and his eyes burn. Every time he closed them, he saw Chen's hands moving with absolute precision through procedures he had dismissed as beyond her capability. The cognitive dissonance between what he had assumed and what he had witnessed created a mental itch he could not ignore. He gave up on sleep at 0700 and headed to the team room, where his men were already gathering for their scheduled debrief about the previous night's incident. The official story called it a training accident during a live fire exercise, which was close enough to the truth for public consumption. The actual story involved classified operations parameters that would remain buried in reports he would spend the next week completing. Chief Petty Officer Ramirez was already in the medical bay when Morrison found him, organizing supplies with a methodical precision that made him the most trusted medic in the group. Morrison leaned against the doorframe and watched his senior medical specialist work for a moment before speaking. "Tell me about hospital corpsman training," he said without preamble. Specifically, what procedures they learn in standard school versus advanced programs. Ramirez looked up from the supply inventory he was conducting and gave Morrison the kind of look that suggested he knew this question had a specific origin. "Standard corpsman school covers basic emergency medicine," he said, setting down his clipboard. "They learn foreplacement, basic airway management, wound treatment, medication administration. Is solid foundational training, but not surgical level." "What about thoracotomies?" Morrison asked. "Or advanced hemorrhage control using pressure point techniques?" Ramirez's expression shifted from professional interest to genuine curiosity. "Those are not standard corpsman procedures," he said carefully. "Emergency thoracotomy is typically battalion surgeon level or higher. The specific pressure point control you are describing sounds like special operations combat medic training. That is an entirely different program that requires selection and months of additional education beyond basic corpsman school." Morrison absorbed this information and added it to the growing list of data points that did not fit the simple category he had tried to force Chen into. Where would someone get that level of training? He asked, knowing the answer would confirm what he had already begun to suspect. "Special operations units," Ramirez said. "Marine Raiders, MARSOC, sometimes conventional units with surgical support teams attached. But mostly the advanced independent procedures. Those are reserved for medics who will be operating in small teams where no surgeon is available and evacuation might be delayed." He paused, clearly connecting dots in his own mind. "Why are you asking about this?" Morrison considered how much to share about the previous night's events and decided that his senior medic deserved the full context. "The nurse who saved Rodriguez's life last night," he said. "She performed an emergency thoracotomy in the trauma bay. She also used pressure point control to stop a femoral bleed before the surgeon arrived. Her techniques were not standard nursing protocols." Ramirez set down his supplies entirely and gave Morrison his full attention. That nurse was not just a nurse, he said, the statement landing with the weight of professional recognition. Someone with those skills served downrange in a combat medicine capacity. Probably multiple deployments based on the confidence level you are describing. Morrison returned to the administrative office and logged into the Navy personnel system with his standard access credentials. He typed in Chen's name and watched the basic service record populate on his screen. Lieutenant Sarah Chun, current assignment Naval Medical Center San Diego. Previous assignments included Naval Medical Center Portsmouth and Naval Hospital Okinawa. The overseas postings suggested operational experience, but the details remained frustratingly vague. Her rating showed hospital corpsman, confirming what Vasquez had observed on her uniform the previous night. Her rank showed 03, a lieutenant with approximately 6 years of commission service based on the dates listed. But several sections of her record displayed the dreaded phrase, access restricted, in red text where details should have been visible. Morrison's 03 clearance was insufficient to view significant portions of her service history. He picked up his desk phone and dialed a contact at the Bureau of Medicine and Surgery who owed him a favor from a previous joint training exercise. The conversation lasted less than 3 minutes and provided Morrison with information that made his stomach drop. Lieutenant Chen's full service record required 06 clearance to access, his contact explained, which meant her assignments included classified operations or special programs that the Navy considered sensitive enough to restrict from standard personnel review. Morrison thanked his contact and ended the call, then sat back in his chair and processed the implications. Restricted records meant she had done things and been places that would never appear in official biographies. 06 clearance requirements suggested involvement with sensitive operations at levels that typical hospital corpsmen never reached. Combined with her demonstrated combat medicine skills and the multiple overseas deployments, the picture emerging was of someone whose background made his earlier dismissal not just inappropriate, but professionally embarrassing. The realization hit him with uncomfortable clarity. He had told a superior officer to wait for the doctor because she was just a nurse, when in reality, she held a higher rank than his own 02 lieutenant status and possessed medical credentials that apparently warranted classification protection. He had obstructed her emergency medical treatment of his own teammates based on assumptions about gender and role that had proven catastrophically wrong. The professional implications of this error went beyond simple discourtesy into the realm of violations that could damage his career. Vasquez appeared in the doorway of the administrative office with the expression of someone bringing news their commander would find significant. "Sir," he said, "I spoke with some of the hospital staff during my visit to check on the team this morning. They said Lieutenant Chun has been working at the hospital for 8 months. Nobody knew about her military background beyond the basic corpsman rating. She apparently never mentioned any deployments or special training." This detail added another layer to Morrison's understanding. Chun had deliberately chosen anonymity, working as a staff nurse without leveraging whatever distinguished service record she possessed. Most veterans with significant operational experience made their credentials known, both for professional advancement and for the respect such service commanded. Chen's decision to remain quiet about her background suggested either humility or an active desire to leave that part of her life behind. Porter joined the conversation with his own contribution to the emerging intelligence picture. "I checked the hospital's public staff directory," he said. Her biography lists her nursing degree from San Diego State and her current certifications. No mention of military service before her nursing career. She must have enlisted first, done her corpsman time, then gotten commissioned somehow, and went to nursing school. The enlisted to officer progression explained her current rank and credentials, but it also meant she had earned her commission through performance rather than starting as an officer through a standard program. That path typically required exceptional service records and strong recommendations from senior leaders who had witnessed her capabilities firsthand. Morrison added this to his mental file of evidence, suggesting Chun was considerably more than the simple category he had tried to assign her. He stood from his desk and made a decision that would require swallowing significant pride. "I need to go back to the hospital he told his men. "I need to apologize to Lieutenant Chun for my conduct last night, and I need to do it properly with full acknowledgement of the errors I made." The words tasted bitter, but Morrison's SEAL training had taught him that admitting mistakes quickly was better than allowing them to compound into bigger problems. Ramirez appeared in the doorway as Morrison was preparing to leave. "One more thing you should know," the chief said. "I called a friend who works at Portsmouth Naval Medical Center, where Lieutenant Chun was previously stationed. He remembered her. She apparently saved a Marine's life in their parking lot about 2 years ago. Car accident victim with massive trauma. She performed a field emergency response that her friend described as full combat trauma protocols. He said it was the most impressive medical intervention he had seen outside an actual war zone." Morrison absorbed this final piece of information and recognized it as confirmation of the pattern he had already identified. Chun carried her combat medicine skills with her everywhere, ready to deploy them whenever circumstances demanded, regardless of whether she was in a war zone or a hospital parking lot. That level of ingrained response came from repeated exposure to traumatic situations where hesitation meant death. She had been formed by experiences that his team was only beginning to accumulate, and he had dismissed her expertise because it came packaged in nursing scrubs instead of combat utilities. Dr. Patricia Williams arrived at her office at Naval Medical Center San Diego at 1300 hours, earlier than her usual shift start time, but later than she had hoped. The previous night's mass casualty event had consumed her morning with administrative reports and case reviews that hospital leadership required after any major trauma incident. Her mind kept returning to Lieutenant Chen's performance during those critical hours, specifically the technical proficiency that seemed inconsistent with a standard nursing background. She pulled up Chen's employment file on her computer and began reading with the careful attention of someone looking for details she had previously overlooked. The basic information matched what she already knew from working alongside Chun for 8 months. Bachelor of Science in Nursing from San Diego State University, registered nurse license current and unrestricted, advanced cardiac life support certification, trauma nursing core course completion. Everything appeared completely standard for an experienced emergency department nurse. Williams scrolled down to the employment history section and found the previous positions Chun had listed. Staff nurse at Naval Medical Center Portsmouth for 2 years. Staff nurse at Naval Hospital Okinawa for 18 months before that. The overseas assignment caught Williams's attention because military medical facilities abroad typically serve populations with higher trauma volumes and more complex cases than stateside hospitals. Okinawa, in particular, supported forward deployed forces and received casualties from throughout the Pacific region. The emergency contact section listed only a brother in Seattle with no other family members noted. The personal information section showed Chen's military status as active duty Navy, which Williams had known, but provided no additional details about her service history beyond her current hospital corpsman rating. Williams frowned at the absence of deployment information or unit assignments, details that typically appeared in military employment files to help administrators understand an applicant's full background. She picked up her desk phone and dialed the main number for Naval Medical Center Portsmouth, asking to be connected to the emergency department. The colleague who answered was someone Williams had worked with during her own residency years earlier, making the conversation easier to navigate toward the specific information she needed. "I'm calling about one of your former nurses," Williams explained. "Lieutenant Sarah Chun. She worked in your emergency department before transferring here to San Diego. I need to know more about her clinical background." The response came with immediate recognition and enthusiasm. "Sarah Chun, absolutely, I remember her. Exceptional trauma nurse, probably the best we had during her time here. She saved a Marine's life in our parking lot about 2 years ago, full emergency response to a severe car accident." Her Portsmouth colleague paused before continuing with a note of curiosity in her voice. "Did she tell you about her deployments?" Williams felt her attention sharpen at this question. "What deployments?" she asked, realizing that Chun had never mentioned any combat service during their 8 months working together. The Portsmouth colleague lowered her voice slightly, as though sharing information that might be sensitive. She served with Marine infantry units overseas, multiple combat deployments for what I understand. She never talked about it much, but her techniques were clearly learned downrange. The way she approached mass casualties, her comfort with improvised procedures, her absolute calm under pressure. That has not come from stateside training. Williams thanked her colleague and ended the call, then sat back in her chair and processed this new information. Combat deployments with Marine infantry units meant Chun had treated battlefield casualties under fire, working in conditions where medical resources were limited and evacuation times were measured in hours rather than minutes. It explained the advanced trauma skills Williams had observed, but it also raised questions about why Chun had never mentioned this significant aspect of her background. She walked down to the emergency department and found Chun at the nurse's station completing charts from the overnight shift. The younger nurse looked tired but maintained her usual professional composure, her uniform clean despite the long hours she had just worked. Williams approached and gestured toward the staff break room, suggesting they talk privately. Inside the break room, Williams poured 2 cups of coffee and sat down across from Chun with the direct approach that had served her well throughout her medical career. "I called Portsmouth this morning," she said without preamble. "My colleague there told me about your deployments with Marine units. She mentioned you serve in combat zones multiple times. Why did you never mention any of this?" Chin wrapped her hands around the coffee cup and took a moment before responding. "Because I did not need to," she said simply. "My nursing credentials and my current performance are what matter in this job. My past service is exactly that past." Williams studied her colleague's expression and recognized the careful neutrality that suggested this was a topic Chun had navigated many times before. "How many deployments are we talking about?" she asked gently, making it clear this was professional curiosity rather than interrogation. "4, Chin answered after a brief hesitation. "Iraq twice and Afghanistan twice. I served with 1st Marine Division, working in battalion aid stations and forward surgical teams." The words came out matter-of-fact, describing experiences that Williams knew represented some of the most intense combat medicine scenarios the modern military could offer. 1st Marine Division meant infantry operations in the most contested areas of both conflicts. Battalion aid stations meant Chun had been the primary medical provider for entire units operating in hostile territory. Forward surgical teams meant she had performed emergency procedures in 10 hospitals under conditions that made the previous night's trauma bay seem almost comfortable by comparison. Williams absorbed these details and understood why Chen's performance had seemed so exceptional. She was operating well below her actual capability level in the relative safety of a stateside emergency department. The break room door opened and Lieutenant Morrison entered, pausing when he saw both women sitting at the table. He had clearly been looking for Chun specifically, and his expression suggested he had come prepared to have a difficult conversation. "Dr. Williams, Lieutenant Chun," he said formally. "I apologize for interrupting, but I need to speak with Lieutenant Chun if she has a moment." Williams stood and gathered her coffee cup, recognizing that whatever Morrison needed to discuss should happen without her presence. She gave Chun an encouraging nod before leaving the break room, though she positioned herself in the hallway where she could intervene if necessary. Her protective instincts toward her nursing staff had intensified now that she understood more about Chen's background and the disrespect she had endured the previous night. Morrison waited until the door closed behind Williams before speaking. He had clearly rehearsed this conversation, but his military bearing could not completely hide the discomfort underlying his words. "Lieutenant Chun, I need to apologize for my conduct last night. I dismissed your medical authority, I interfered with your emergency treatment of my teammates, and I showed you disrespect based on assumptions that were completely wrong. There is no excuse for my behavior, and I take full responsibility for it." Chen listened to this apology with the same neutral expression she had maintained throughout their previous interactions. She let the silence extend for a moment after Morrison finished speaking, weighing her response with visible care. "Your apology is noted," she said finally, "but you should understand that my rank and my service record are not what made your behavior inappropriate. You interfered with emergency medical care in a trauma bay where I had the clinical authority regardless of my background. The issue was not about respecting my past. It was about respecting my present role. Morrison nodded slowly, processing this distinction and recognizing the principle Chun was articulating. "You are right," he said. "I should have trusted your clinical judgment based on your position and your demonstrated competence. Everything else is secondary to that basic professional respect." Chen stood and moved toward the break room door, clearly considering this conversation concluded. "I left special operations medicine behind because I was tired of constantly proving my competence to people who made assumptions based on my gender rather than my performance. I came here to work as an emergency nurse where my credentials should speak for themselves. Last night demonstrated that apparently, even in a hospital, some people need my entire service record before they will trust my medical judgment." The words landed with precision, identifying exactly what had happened and why it represented a failure beyond simple military protocol. Morrison had not just disrespected a superior officer. He had embodied the exact attitude that had driven Chun to leave the work she was clearly exceptional at performing. She walked out of the break room, leaving Morrison to confront the full weight of how his assumptions had reinforced the very dynamic she had tried to escape. Commander Robert Hayes received the incident report at 1400 hours while reviewing operational readiness assessments in his office at Naval Special Warfare Group 1. The document detailed the previous night's training accident and subsequent medical response, written with the careful language that military reports use to describe events without assigning blame prematurely. Hayes read through the timeline and found himself pausing at several points where the narrative suggested complications beyond standard emergency room procedures. The report mentioned that Lieutenant Morrison and 2 team members had remained in the trauma bay during initial treatment despite medical staff requests for them to clear the area. It noted that 1 patient required emergency thoracotomy performed by nursing staff, an unusual procedure that warranted documentation. It referenced multiple life-saving interventions by Lieutenant Sarah Chun, the primary nurse managing the mass casualty response. Hayes made a mental note of Chen's name and rank, recognizing that emergency thoracotomy was not a standard nursing procedure and wondering what training background made such an intervention possible. He walked down the hallway to Morrison's office and found the lieutenant reviewing after-action reports with Vasquez and Porter. The 3 men stood when their commanding officer entered, their body language suggesting they had been discussing something more serious than routine paperwork. Hayes gestured for them to sit and pulled a chair from the corner to join their impromptu meeting. "Tell me about last night," he said without preamble. "The official report gives me facts, but I need context about what actually happened in that emergency room." Morrison took a breath before responding, his expression reflecting the kind of discomfort that suggested he knew this conversation would not be easy. "Sir, we failed to follow proper protocol when medical staff requested we clear the treatment area. I specifically dismissed the primary nurse's authority and interfered with her emergency care of Petty Officer Davis. My actions were inappropriate and potentially endanger my teammates by delaying treatment." Hayes listened to this admission with the focused attention of a commander who recognized when personnel issues required his direct involvement. "What was your reasoning for dismissing her authority?" he asked, keeping his tone neutral to encourage complete honesty rather than defensive justifications. Morrison met his commanding officer's eyes directly. "I assumed she lacked the expertise to treat our casualties properly, sir. She was wearing nursing scrubs, and I made judgments based on that rather than observing her actual competence. It was a failure of professional judgment on my part." Hayes noted the careful phrasing that avoided explicitly mentioning gender, but clearly pointed toward assumptions based on more than just clothing. "And what did you learn after making this judgment?" he asked, already anticipating that the answer would explain why Morrison seemed genuinely troubled by his actions rather than merely going through the motions of acknowledging a minor protocol violation. Morrison's jaw tightened slightly before he responded. "Lieutenant Chun performed an emergency thoracotomy that saved Lieutenant Rodriguez's life, sir. She also used advanced hemorrhage control techniques on Corporal Hayes that I recognized as Special Operations Medicine. Her clinical performance was exceptional. After the emergency, I discovered she is a lieutenant, not enlisted, and her service record is partially classified, requiring O6 clearance to access fully. Hayes felt his attention sharpen at this information. Classified service records suggested involvement with sensitive operations or special programs that warranted protection from standard personnel review. Combined with advanced combat medicine skills, the picture suggested Chun possessed a background considerably more distinguished than typical nursing staff. He stood and returned to his office, leaving Morrison to continue his work while Hayes investigated this situation more thoroughly. The Navy personnel system responded to Hayes's O6 credentials by unlocking sections of Chin's record that Morrison had been unable to access. Hayes read through the newly visible information with growing respect and corresponding concern about how his men had treated this particular officer. Lieutenant Sarah Chun, prior enlisted hospital corpsman 3rd class, served with 1st Marine Division during 4 combat deployments spanning 6 years. Attached to Marine Raiders for final 2 deployments in specialized combat medicine role. Hayes scrolled down to the awards section and felt his stomach drop. Navy Cross for extraordinary heroism during extended firefight in Helmand Province, Afghanistan. 3 Purple Hearts for wounds received in combat. Combat Action Ribbon with 2 stars indicating multiple engagements. Navy and Marine Corps Commendation Medal with Combat Distinguishing Device. The list continued with additional decorations that painted a picture of someone who had repeatedly distinguished herself under the most demanding circumstances the military could offer. The citation for her Navy Cross provided specific details that explained why her record warranted classification. On March 15th, Hospital Corpsman 3rd Class Sarah Chen's unit came under sustained enemy fire, resulting in 23 casualties over 4 hours. Despite receiving 2 separate wounds that would normally warrant evacuation, Chen remained in the engagement area treating casualties under direct fire. Her actions directly resulted in saving 17 Marines who would otherwise have died from their injuries before evacuation became possible. Her tactical medical decisions and extraordinary courage under fire exemplify the highest traditions of naval service. Hay sat back in his chair and processed the implications. His men had dismissed and disrespected the 2nd highest Valor Award recipient currently serving in the Navy medical community. They had told a Navy Cross recipient to wait for the doctor because she was just a nurse. They had interfered with emergency medical care provided by someone whose combat medicine credentials exceeded anything his SEAL team's organic medics had accumulated. The professional failure this represented went far beyond simple protocol violations into the realm of command climate issues that reflected poorly on his leadership. He picked up his office phone and called the hospital's main administrative line, requesting to speak with whoever managed nursing staff assignments. The conversation that followed provided additional context that made the situation even more troubling. Yes, Commander, Lieutenant Chun has been working here for 8 months, the administrator confirmed. She applied for a staff nurse position after transferring from Portsmouth. Very quiet, very professional. Never mentioned her military background beyond her basic hospital corpsman credentials. Hayes thanked the administrator and ended the call, then sat in silence for several minutes, considering how to address this situation appropriately. Chun had deliberately chosen anonymity, working as a staff nurse without leveraging her distinguished service record for recognition or advancement. His men had created exactly the kind of gender-based assumption environment that had apparently driven her to leave Special Operations Medicine for a less prestigious but more respectful role. He stood and walked back to Morrison's office, where the lieutenant was now alone reviewing casualty reports. Morrison looked up as his commander entered and immediately recognized from Hayes's expression that the situation was more serious than he had initially understood. "Sir," Morrison began, but Hayes raised a hand to forestall whatever the lieutenant had planned to say. "Lieutenant Chun is a Navy Cross recipient with 3 Purple Hearts," Hayes said without preamble. "She saved 23 Marines during a 4-hour firefight while wounded twice. She served with Marine Raiders in a specialized combat medicine role that required clearance I just used my '06 credentials to access. You told her to wait for the doctor because she was just a nurse. Do you understand the magnitude of the professional failure that represents? Morrison's face went pale as he processed this information. The Navy Cross sat just below the Medal of Honor in the military's hierarchy of valor awards. 3 Purple Hearts meant Shun had been wounded in combat 3 separate times and continued serving. Marine Raiders represented the Marine Corps' Special Operations Component, equivalent to Navy SEALs in selection standards and operational capability. Morrison had dismissed someone whose credentials in her specialized field exceeded his own by considerable margins. I need you to understand something, Hayes continued, his voice remaining level but carrying the weight of command authority. This is not just about disrespecting a superior officer, although that alone would be serious enough to warrant formal action. This is about the assumptions you made based on gender and role rather than observing actual competence. Lieutenant Chun left Special Operations Medicine to work as a staff nurse, and based on what you have told me, she did so at least partially to escape exactly the kind of treatment you gave her last night. Your conduct reinforced the very dynamic she was trying to leave behind. Morrison returned to Naval Medical Center San Diego at 1800 hours, carrying the weight of knowledge that made his previous apology seem inadequate. He had spent the afternoon since Commander Hayes' revelation processing the full scope of his failure, understanding now that his assumptions had not just been wrong, but had represented exactly the kind of institutional bias that drove exceptional people away from roles they excelled at performing. The hospital lobby felt different now, less like neutral territory and more like a place where he had committed an offense that required proper acknowledgement. He found Chun at the nurse's station reviewing patient charts for the incoming night shift. She looked up as he approached, and her expression remained professionally neutral, neither welcoming nor hostile, but simply waiting to see what this visit would bring. Morrison had rehearsed several versions of what he needed to say, but standing in front of her now, the carefully prepared words felt insufficient for the situation they needed to address. Lieutenant Chun, he began, using her rank deliberately. I need to speak with you if you have time. What I said earlier today was incomplete. I have since learned information that makes me understand the full extent of my failure last night, and I owe you a more complete apology than the one I offered this morning. Chin set down the chart she had been reviewing and gestured toward a quiet corner of the nurse's station where they could speak without disrupting the department's operations. Her body language suggested she was willing to hear what Morrison had to say, but remained guarded about his intentions. Morrison followed her to the corner and took a moment to organize his thoughts before continuing. Commander Hayes accessed your full service record today, Morrison said, choosing directness over diplomatic phrasing. He shared with me that you are a Navy Cross recipient with 3 Purple Hearts. He told me about Helmand Province and the 23 Marines you saved while wounded. He explained that you served with Marine Raiders in a specialized combat medicine role that my team's organic medics will likely never reach in their entire careers. Chin's expression remained neutral, but something flickered in her eyes that might have been resignation or perhaps simply acknowledgement that her carefully maintained anonymity had been breached. Morrison continued before she could respond, needing to complete what he had come to say. I came here this morning to apologize for disrespecting a superior officer and interfering with emergency medical care. That apology was sincere, but it was also incomplete because I did not fully understand what I had done. Now I understand that I treated you exactly the way you left Special Operations to escape. I made assumptions based on gender and role rather than observing your actual competence. And in doing so, I reinforced the very dynamic that drove you away from work you were clearly exceptional at performing. Chin listened to this expanded apology with visible consideration, weighing Morrison's words against her experiences and deciding how to respond. After a moment of silence, she spoke with the same directness he had used. Your apology is noted, and I appreciate that you recognize the broader implications of what happened. But I need you to understand something that Commander Hayes may not have explained. I did not leave Special Operations because I could not handle the work or because I lacked the resilience to deal with difficult people. I left because I was tired of being the female combat medic instead of just the combat medic. I was exhausted by constantly having to prove my competence to people who assumed I was less capable based on their expectations rather than my performance. Morrison nodded, recognizing the truth in her words and understanding how his behavior had exemplified exactly what she was describing. "I cannot undo what I said or how I treated you last night," he said, "but I can tell you that I have learned from this failure, and I will be teaching respect protocols to our new candidates using this incident as an example of what not to do. If there is anything else I can do to make this right, I am willing to do it." Chen appeared to consider this offer before responding. "What you can do is remember that expertise does not always look the way you expect it to look. Some of the most competent people I have worked with did not advertise their credentials or demand recognition for their past service. They simply did excellent work and expected that work to speak for itself. The fact that I chose to work as a staff nurse rather than leveraging my military background for a more prestigious position does not make my clinical judgment less valid or my medical authority less real." Morrison absorbed these words and recognized them as both a teaching moment and a clear statement of Chen's principles. He had one more question that had been troubling him since learning about her background, though he hesitated to ask it because the answer might be something he did not want to hear. "May I ask why you chose nursing over staying in combat medicine?" he said carefully. "Someone with your credentials could have continued in special operations or moved into leadership roles training the next generation of combat medics." Chen's expression shifted slightly, showing something that might have been old frustration surfacing despite her professional composure. "Because I wanted to save lives without constantly fighting for the right to do so," she said. "In combat medicine, I spent as much energy proving I belonged there as I did actually treating patients. Every new unit meant starting over with people who assumed I was less capable. Every deployment meant dealing with someone who thought female medics should not be with infantry units. I won 4 deployments worth of respect and still had to re-earn it every time I encountered someone new. Nursing offered me a chance to use my skills without that constant battle." Morrison felt the weight of this explanation and understood that his actions had proven her assessment correct even in the civilian nursing environment she had chosen specifically to escape such treatment. "Your teammates who you saved in Helmand Province," he said. "Do you think any of them question your competence based on your gender?" Chen's response came immediately. "No, they did not. The Marines I served with learned to trust my medical judgment because I demonstrated it consistently under fire. But those Marines are not representative of the broader military culture. For every unit that judged me on performance, there were others where I had to fight for basic professional respect. I got tired of that fight and chose a different path where my credentials should have spoken for themselves." Morrison recognized that he had been given a considerable education in the span of one difficult conversation, and that Chen had been generous in sharing her perspective despite having every reason to simply accept his apology and end the discussion. He stood and prepared to leave, knowing that words alone could not repair the damage his assumptions had caused, but hoping that his acknowledgement of the failure represented at least a starting point. "Thank you for explaining this to me," he said. "I know it was not your responsibility to educate me about the impact of my behavior, and I appreciate that you were willing to do so anyway." Chen nodded once, accepting his thanks, but not offering reassurance that everything was resolved or forgotten. Morrison left the hospital understanding that some mistakes could not be fully corrected, only acknowledged and learned from. Commander Hayes was waiting in the parking lot when Morrison emerged, his presence suggesting he had anticipated that Morrison would come to the hospital and wanted to discuss the outcome of that visit. "How'd it go?" Hayes asked as Morrison approached his vehicle. Morrison considered the question and provided an honest assessment. She explained why she left special operations and why my behavior represented exactly what she was trying to escape. She was clear that the issue was not about my failure to recognize her specific credentials, but about making assumptions based on gender and role rather than observing actual competence. I learned more in that conversation than I have in most formal training sessions. Hayes nodded with the expression of a commander who had expected this outcome. That conversation was important, but it does not fully address the institutional failure your actions represented. I will be initiating a formal investigation into this incident, not to punish you specifically, but to ensure we document the lessons learned and implement them into our training protocols. This needs to be on record so that future generations of operators do not repeat the same mistakes. Commander Hayes initiated the formal investigation 72 hours after the incident, following standard protocols that required preliminary fact-gathering before official proceedings began. The conference room at Naval Special Warfare Group 1 headquarters held an atmosphere of professional gravity as Hayes convened the review board consisting of himself, 2 other O5 commanders from sister SEAL teams, and a JAG officer who would ensure proper legal procedures were followed throughout the inquiry. Morrison sat across from the board with Vasquez and Porter flanking him, all 3 men in their dress uniforms for the formal proceeding. Hayes had made clear this was not a court-martial, but rather an administrative review to determine appropriate corrective action and identify systemic issues requiring institutional response. Morrison understood that the outcome would likely include formal documentation in his service record regardless of the board's ultimate recommendations. The JAG officer began by reading the charges into the record. Lieutenant Morrison, you stand before this board to address allegations that on the night of October 8th, you dismissed the medical authority of Lieutenant Sarah Chun during emergency treatment of casualties, interfered with her provision of care, and showed disrespect to a superior officer based on assumptions regarding her gender and role. Additionally, Sergeants Vasquez and Porter are alleged to have supported this interference through their actions and statements. How do you respond to these allegations? Morrison stood and faced the board directly. I accept full responsibility for all charges as described, he said without hesitation. My actions were inappropriate, endangered my teammates by delaying necessary medical treatment, and violated both military protocol and professional standards. I made assumptions about Lieutenant Chen's competence based on her role as a nurse rather than observing her demonstrated expertise. My failure created the environment that led Sergeants Vasquez and Porter to act as they did, and I request that any disciplinary action focus on my conduct rather than theirs. Hayes appreciated Morrison's acceptance of responsibility, but knew the board needed to establish the full scope of what had occurred. Lieutenant Morrison, please describe for the board the specific actions you took that interfered with Lieutenant Chen's medical care of your casualties. Morrison took a breath before responding, his voice steady as he detailed events that clearly troubled him to recall. When we arrived at the hospital with 6 critical casualties, Lieutenant Chen directed my team to clear the trauma bay to allow medical staff to work. I refused this instruction and told my men to remain with our wounded teammates. When Petty Officer Davis required emergency intervention for tension pneumothorax, Lieutenant Chen began the procedure, and I instructed her to wait for the doctor, specifically using the phrase that she was just a nurse. She ignored my interference and completed the life-saving procedure. My actions delayed care and demonstrated disrespect for her medical authority based on assumptions that proved completely wrong. One of the O5 commanders on the board leaned forward with a question. Lieutenant Morrison, when did you first realize that your assumptions about Lieutenant Chen's competence were incorrect? Morrison considered the question carefully. Sir, I began questioning my assumptions when I observed her pressure point control technique on Corporal Hayes' femoral artery wound. The hand placement she used was advanced combat medicine, not standard nursing procedure. My doubts increased when she performed an emergency thoracotomy on Lieutenant Rodriguez that saved his life. By the time I learned she was a lieutenant rather than enlisted personnel, I already understood I had made serious errors in judgment. The board proceeded through detailed questioning of all 3 SEALs, establishing a timeline of events and documenting each instance where medical authority had been challenged or emergency care had been delayed. Hayes directed questions toward understanding not just what had happened, but why these particular assumptions had been made, seeking to identify the cultural factors that had contributed to the incident. After 2 hours of testimony and questioning, the board moved into closed deliberation. Morrison and his men waited in an adjacent office while the board reviewed the evidence and determined appropriate actions. Hayes knew the outcome before deliberations began because the facts were not in dispute and Morrison had accepted full responsibility. But proper procedure required the board to formally review all information before rendering decisions. The board reconvened after 40 minutes, and Hayes read the findings into the record. This board finds that Lieutenant Morrison, Sergeant Vasquez, and Sergeant Porter violated military protocol by dismissing the medical authority of a superior officer and interfering with emergency medical care. The board further finds that these violations stemmed from gender-based assumptions regarding Lieutenant Chen's competence that were inconsistent with both her demonstrated expertise and her distinguished service record. The board recommends the following corrective actions. Hayes paused to ensure the JAG officer was properly documenting his words before continuing. Lieutenant Morrison will receive a formal letter of reprimand to be placed in his service record. He will complete mandatory training on inter-service respect protocols, medical authority recognition, and gender bias awareness. Additionally, Lieutenant Morrison will prepare and deliver training materials on this incident to all SEAL candidates in the next basic underwater demolition training class, using his own failure as a teaching example of inappropriate conduct. The formal letter of reprimand represented a significant mark on Morrison's otherwise exemplary record, likely delaying his promotion timeline and requiring explanation in future fitness reports. Morrison accepted this consequence with visible understanding that his actions warranted documentation that would follow him throughout his career. Sergeants Vasquez and Porter will receive formal counseling statements documenting their role in supporting Lieutenant Morrison's interference with medical care, Hayes continued. They will complete the same mandatory training as Lieutenant Morrison. However, given that they were following their officer's lead and their involvement was secondary to his primary failure, the board does not recommend letters of reprimand for their records. Hayes set down the paper he had been reading from and addressed Morrison directly. Lieutenant, this board recognizes that you have accepted full responsibility for your actions and demonstrated genuine understanding of the failures those actions represented. However, the seriousness of dismissing a Navy Cross recipient's medical authority based on gender assumptions requires formal documentation and institutional response. The letter of reprimand and required training are intended not as punishment, but as acknowledgement that this incident represents a learning opportunity for the entire SEAL community. Morrison stood and addressed the board formally. I accept the board's recommendations, and I commit to ensuring that my failure becomes a teaching moment that prevents future operators from making similar mistakes. I request permission to personally deliver a written apology to Lieutenant Chen as part of my corrective actions. The board granted this request and concluded the formal proceedings. Hayes remained in the conference room after the others departed, reviewing his notes and preparing the next phase of institutional response. The individual accountability portion was complete, but Hayes recognized that Morrison's actions reflected broader cultural issues within the special operations community that required systemic attention beyond disciplining 3 people. He drafted a message to the commanding officer of Naval Special Warfare Command recommending implementation of new protocols for medical authority recognition. The message detailed the incident without naming specific individuals, but highlighted the systemic failure it revealed. Hayes proposed mandatory briefings on the credentials of all military medical personnel when units interfaced with hospital facilities, ensuring operators understood the expertise levels of the people providing their care. Additionally, Hayes recommended incorporating gender bias awareness training into the SEAL qualification pipeline, using real incidents like this one to demonstrate how assumptions about competence based on gender could endanger lives and undermine operational effectiveness. The special operations community prided itself on selecting the most capable individuals regardless of background, but Hayes recognized that selection standards meant nothing if operators then dismissed that capability based on assumptions that contradicted observable performance. The institutional changes Hayes proposed would take months to implement through the Navy's bureaucratic processes, but he considered this necessary work that extended beyond the immediate incident. Morrison's failure had been individual, but the assumptions underlying that failure reflected cultural patterns that appeared throughout the military. Using this incident to drive systemic change represented an opportunity to improve how special operations forces interfaced with medical professionals and recognized expertise in forms they might not expect. Hayes sent the message through official channels and then composed a separate email requesting a meeting with Lieutenant Chun. She deserved to understand what actions the command was taking in response to the incident and to have input on the institutional changes being proposed. Her perspective as someone who had left special operations specifically to escape the treatment she received would be valuable in designing training that actually addressed the underlying issues rather than simply checking administrative boxes. Commander Hayes waited in the hospital parking lot at 2100 hours, timing his arrival to coincide with the end of Chen's shift. He had requested this meeting through official channels, sending her an email that explained he needed to discuss the investigation's outcome and institutional responses being implemented. Chun had agreed to meet, but specified that she preferred the conversation happen away from the hospital, where colleagues might overhear discussions about her military background. She emerged from the employee entrance wearing civilian clothes, her nursing scrubs exchanged for jeans and a simple jacket that made her look younger than her service record suggested. Hayes stood as she approached his vehicle, maintaining the professional bearing that the conversation required despite the informal setting. "Lieutenant Chun, thank you for agreeing to meet with me. I know this has been a difficult situation, and I appreciate your willingness to discuss it further." Chun nodded acknowledgement and gestured toward a bench near the parking lot entrance where they could sit and talk without the confined space of a vehicle creating additional awkwardness. Hayes followed her lead and waited for her to settle before beginning the conversation he had prepared. "I wanted to inform you personally about the outcome of the formal investigation into the incident with Lieutenant Morrison and his team." He detailed the board's findings and the corrective actions that had been implemented, including the letter of reprimand for Morrison and the mandatory training for all 3 SEALs involved. Chun listened without visible reaction, her expression remaining professionally neutral in a way that suggested she had expected something along these lines. Hayes continued with the institutional changes he had proposed to Naval Special Warfare Command, explaining the new protocols for medical credential briefings and gender bias awareness training. When he finished, Chun sat in silence for a moment before responding. "I appreciate that you took this seriously enough to conduct a formal investigation and implement systemic changes. Most incidents like this get handled with informal counseling and forgotten within a week. The fact that you are documenting it and using it for training purposes suggests you understand this was not just about 3 individuals making poor decisions." Hayes nodded, recognizing the truth in her assessment. This incident revealed cultural patterns that extend beyond your specific situation. The assumptions Lieutenant Morrison made are not unique to him. They reflect broader attitudes about gender and expertise that appear throughout the military, particularly in special operations communities that have historically been male-dominated. If we do not address these attitudes systematically, we will continue losing exceptional people like you who get tired of fighting for basic professional respect. Chen's expression shifted slightly, showing something that might have been appreciation for Hayes's understanding mixed with resignation about the broader problem he was describing. "Commander, can I ask you something directly?" she said, her tone suggesting this question mattered more than simple curiosity. "Why did you decide to pursue formal action rather than handling this quietly?" Morrison apologized. "I accepted it, and we could have moved on without documentation that will follow him throughout his career." Hayes had anticipated this question and prepared an honest answer. Because informal resolution would have treated this as an isolated incident between specific individuals rather than recognizing it as symptomatic of larger institutional issues. Morrison needed to face formal consequences not as punishment, but as acknowledgement that his actions represented a serious professional failure. More importantly, the SEAL community needed this incident documented and analyzed so we can teach future operators not to repeat these mistakes. Chun absorbed this explanation with visible consideration. "What about my service record?" she asked, How many people now know about my background who did not know before? I chose to work here anonymously specifically to avoid being defined by my past rather than my present performance. Hayes understood the delicate balance this question represented. Your full service record remains restricted to those with appropriate clearance levels. I shared relevant portions with the investigation board under proper security protocols, and they are bound by the same classification restrictions that protect your information. Lieutenant Morrison knows you are a Navy Cross recipient because I told him in the context of explaining the magnitude of his failure. But the broader hospital staff has not been informed unless you chose to share that information yourself. Chin nodded slowly, appearing somewhat relieved by this answer. I did not earn those decorations, so I could use them as credentials to win arguments or demand respect. I earned them by doing my job under difficult circumstances, and then I moved on to a different role where I hoped my current competence would be sufficient. The fact that Morrison needed to know about Helmand Province before he could respect my medical judgment proves exactly why I left Special Operations. Hayes recognized the Principal Chun was articulating and found himself agreeing with her assessment, even as it complicated the institutional changes he was trying to implement. That creates a difficult tension, he acknowledged. On one hand, military culture emphasizes respecting credentials and service records because they represent proven capability. On the other hand, requiring people to constantly prove their past achievements before others will trust their current judgment is exhausting and unfair. Chun leaned back against the bench and looked up at the night sky before responding. When I was treating casualties in Helmand Province, nobody questioned my medical decisions because they could see the results in real time. Marines survived who should have died, and that earned me trust regardless of what anyone thought about female medics. But here in a hospital, people make assumptions based on my scrubs and my gender before they ever observe my clinical performance. Morrison is not unusual in that regard. He just happened to be wrong in a situation where the consequences were obvious. Hayes heard the weariness in her voice and understood it represented years of accumulated frustration rather than this single incident. If I may ask, he said carefully, why did you stay in nursing rather than returning to active combat medicine or training roles? Someone with your experience would be invaluable teaching the next generation of special operations medics. Chen's answer came quickly, suggesting she had considered this question many times. Because I wanted to save lives without constantly fighting for the authority to do so. In combat medicine, every new unit meant starting over with proving I belonged there. Every deployment meant encountering someone who thought female medics should be restricted to safer roles. I spent 6 years demonstrating my competence in the most extreme circumstances possible, and I was tired of that demonstration being necessary every single time I met new people. Hayes absorbed this explanation and recognized it as an indictment of military culture that extended far beyond the SEAL community. The military's emphasis on proven capability should have meant that Chen's record spoke for itself, eliminating the need for her to constantly reprove her expertise. The fact that her record failed to provide that protection suggested systemic failures in how the military recognized and respected diverse forms of competence. What would it take for you to consider returning to training roles? Hayes asked, knowing the answer might be that no offer would be sufficient, but wanted to understand what Sean felt was missing from the current system. Not because the SEAL community needs you specifically, though he certainly would benefit from your expertise, but because the military needs people like you in positions where they can shape culture rather than being driven away by it. Chun considered the question seriously before responding. I would need to see evidence that the culture had actually changed rather than simply paying lip service to change. I would need protection from the constant requirement to justify my presence based on my gender rather than my competence. And I would need authority structures that supported my medical judgment without requiring me to reference my service record every time someone questioned my decisions. Those are significant cultural shifts that do not happen quickly or easily. Hayes recognized the wisdom in her requirements and understood they represented exactly the kind of institutional transformation that his proposed training programs were attempting to create. He also recognized that such transformation would take years of sustained effort, and that Chun had no obligation to wait while the military slowly adjusted its culture to properly value her expertise. "May I ask one final question?" he said. "Do you regret your decision to leave special operations for nursing?" Chin's response came without hesitation. "No, I do not regret it. I am good at what I do here. I save lives regularly, and most of my colleagues respect my clinical judgment without needing to know about my military background." The incident with Morrison was frustrating, but it was one night out of 8 months of otherwise positive experience. That ratio is considerably better than what I experienced in special operations, where proving myself was a constant requirement rather than an occasional exception. Hayes thanked Chun for her time and her willingness to discuss these difficult issues openly. He returned to his office understanding that the institutional changes he had proposed were necessary, but insufficient to address the deeper cultural problems that had driven someone like Chun away from roles where her expertise was most needed. The military excelled at recognizing and rewarding conventional forms of excellence, but struggled with expertise that appeared in unexpected packages or challenged traditional assumptions about who belonged in particular roles. The formal investigation concluded 2 weeks after the incident, and Commander Hayes submitted his comprehensive report to Naval Special Warfare Command with recommendations for systemic policy changes. The report detailed the specific failures that had occurred during the emergency response and analyzed the cultural assumptions that had enabled those failures. Hayes included Chin's perspective about why she had left Special Operations Medicine, using her experience as evidence that the military was losing exceptional talent due to preventable cultural issues. Captain Richard Thornton, commanding officer of Naval Special Warfare Group 3, received Hayes's report during his morning briefing and immediately recognized its implications extended beyond a single incident. Thornton had spent 30 years in the SEAL community and understood how deeply certain assumptions about gender and capability were embedded in special operations culture. The fact that a Navy Cross recipient had been dismissed as just a nurse represented a systemic failure that warranted his personal attention. He called Hayes into his office 3 days after receiving the report and gestured for the commander to sit. "Your report on the Lieutenant Chin incident was thorough and troubling," Thornton began without preamble. "I have been in this community long enough to know that what happened with Lieutenant Morrison is not an isolated case. It represents patterns we need to address at the institutional level if we want to retain talented people and maintain our operational effectiveness." Hayes nodded agreement, appreciating that his commanding officer recognized the broader implications rather than treating this as a minor personnel issue. "Sir, Lieutenant Chin's case is particularly striking because her credentials are exceptional and her decision to leave special operations was deliberate. She specifically chose a less prestigious role to escape the constant requirement to prove her competence based on gender. That suggests we are creating environments that drive away exactly the kind of expertise we claim to value." Thornton opened a folder on his desk containing several documents Hayes recognized as official correspondence. "I forwarded your report to the Chief of Naval Operations with a recommendation that your proposed policy changes be implemented across all naval special warfare units. Additionally, I spoke with the Surgeon General of the Navy about implementing medical credential briefings whenever our personnel interface with hospital facilities. Both offices have expressed support for these changes." Hayes felt genuine satisfaction at this news, knowing that institutional change required command-level support to overcome bureaucratic resistance. "What timeline are we looking at for implementation?" he asked. Thornton consulted his notes before responding. "The medical credential briefing protocol can be implemented within 60 days through administrative directive. The gender bias awareness training will take longer because it requires curriculum development and instructor training. I have assigned a team to create the training materials using your report as a foundation. They will include the Lieutenant Chun incident as a case study, though her identity will be protected through classification restrictions." The conversation continued for another 30 minutes as Hayes and Thornton discussed specific implementation details and potential resistance from units, that might view the new training as unnecessary political correctness. Both officers understood that cultural change faced opposition from people invested in existing power structures, and that sustained leadership attention would be necessary to ensure the new protocols became standard practice rather than ignored requirements. Meanwhile, at Naval Medical Center San Diego, Hospital Chief of Medicine Dr. Richard Palmer was conducting his own investigation into how his facility had employed a Navy Cross recipient for 8 months without anyone on the administrative staff being aware of her distinguished service. Palmer had received a courtesy notification from Naval Special Warfare Command about the incident involving Chun, and the notification had prompted him to review her employment file more carefully than he had during the routine approval process when she was hired. Palmer called Dr. Williams into his office to discuss the situation. The attending physician arrived with visible curiosity about why the chief of medicine wanted to speak with her about a staff nurse. Palmer gestured for her to sit and opened Chen's file on his computer screen. "Patricia, I need to understand how we hired Lieutenant Chun without anyone recognizing that she is one of the most decorated combat medics currently serving in the Navy. Her credentials are exceptional, and her service record suggests expertise that exceeds what we typically see in staff nurse positions." Williams had anticipated this conversation since learning about Chen's background during the mass casualty incident. "Sir, Lieutenant Chen applied for a staff nurse position, and her application materials presented standard nursing credentials. She did not include information about her combat deployments or her decorations. Her references came from her previous nursing positions rather than her special operations service. Nothing in her application suggested she was anything other than an experienced emergency department nurse seeking a new position." Palmer absorbed this explanation and recognized that Chun had deliberately presented herself in a way that minimized her military background. "The question is whether we should have recognized her credentials regardless of how she presented them," he said. "Her service record would have been available if we had accessed it through proper military channels. Our failure to do so meant we place someone with extraordinary expertise in a role that does not fully utilize her capabilities." Williams considered her response carefully before speaking. "Sir, with respect, Lieutenant Chun chose to work as a staff nurse despite her qualifications. She could have applied for leadership positions or specialized roles that would have leveraged her combat experience. The fact that she deliberately sought a standard nursing position suggests she wanted to work at that level rather than being defined by her military credentials." Palmer nodded slowly, recognizing the validity of this point. "You are suggesting that offering her a promotion or special recognition might be contrary to what she actually wants from this position." Williams leaned forward with genuine conviction in her voice. "Sir, I have worked alongside Lieutenant Chun for 8 months. She is an exceptional clinician who saves lives regularly and earns respect from her colleagues through her current performance. The incident with the SEAL team was frustrating for her precisely because it required her to reference her military background to establish authority that should have existed based on her present role. If we now make a big deal about her decorations and try to promote her into positions she did not seek, we are doing the same thing in a different form." Palmer appreciated Williams's insight and recognized it aligned with what he had learned about Chen's reasons for leaving special operations. However, he also had institutional responsibilities that included properly utilizing talented personnel and ensuring the hospital benefited from available expertise. What if we offered her a position that recognized her capabilities without making it contingent on her military decorations? He suggested a trauma team lead role, for example, that would give her more authority and better compensation based on her demonstrated clinical performance rather than her past service. Williams considered this compromise and found it more acceptable than a promotion explicitly tied to Chen's military credentials. That might work if it is presented correctly. The key would be framing it as recognition of her current competence rather than belated acknowledgement of her past service. She would need to understand that we are offering the position because of the excellent work she has done here for 8 months, not because we just discovered she is a Navy Cross recipient. Palmer agreed to this approach and asked Williams to facilitate the initial conversation with Chun. The attending physician had developed a professional relationship with Chun that included mutual respect and trust, making her the appropriate person to present an offer that needed careful framing to avoid seeming like the kind of recognition Chun had deliberately avoided. Williams found Chun in the emergency department 2 days later during a relatively quiet morning shift. The younger nurse was reviewing procedure updates and seemed genuinely engaged with the routine administrative tasks that most staff found tedious. Williams pulled up a chair beside her and began the conversation with directness that matched Chin's own communication style. "Sarah, Dr. Palmer wants to offer you the trauma team lead position. Before you immediately decline, I want you to hear the reasoning behind the offer." Chin set down the procedure manual she had been reading and gave Williams her full attention. The trauma team lead role carried significant additional responsibility along with better compensation and more authority over emergency protocols. It represented the kind of advancement that most nurses actively sought after establishing themselves in a new facility. Williams explained that Palmer wanted to offer the position based on Chin's demonstrated clinical excellence over the past 8 months, specifically referencing her performance during routine shifts rather than the mass casualty incident that had revealed her military background. Chin listened to the full explanation before responding. "Is this offer happening because Commander Hayes contacted the hospital about the investigation?" she asked, cutting directly to the question that mattered most to her. "Because if this is the hospital's way of acknowledging my military service, then I am not interested. I came here to work as a nurse, not to be recognized as a former special operations medic." Williams had anticipated this concern and addressed it with the honesty their professional relationship had established. "Dr. Palmer learned about your military background because Naval Special Warfare Command sent a courtesy notification about the incident. That discovery prompted him to review your performance here more carefully, and he realized we have been underutilizing someone with your clinical capabilities. The offer is based on 8 months of excellent work, not on decorations you earned years ago. The timing is unfortunate because it creates exactly the appearance you are worried about, but the reasoning behind it is sound." Chin took 3 days to consider the trauma team lead position before requesting a formal meeting with Dr. Palmer to discuss the offer's details and implications. She arrived at his office during her scheduled break, still wearing her nursing scrubs and carrying the professional demeanor that had characterized her work since arriving at the hospital 8 months earlier. Palmer gestured for her to sit and close his office door to ensure privacy for a conversation he suspected would require careful navigation. "Thank you for taking the time to consider the position," Palmer began. "Dr. Williams explained your concerns about the timing and the appearance that this offer might be connected to your military background rather than your current performance. I want to address those concerns directly before we discuss the role itself." Chin nodded, appreciating Palmer's willingness to acknowledge the complication rather than pretending it did not exist. "Sir, I need to understand whether you would be making this offer if Commander Hayes had not contacted the hospital about the investigation. Because if the answer is no, then this position represents exactly the kind of recognition based on past service that I deliberately left special operations to avoid." Palmer had anticipated this question and prepared an honest answer that he hoped would satisfy Chin's legitimate concerns. "The truthful answer is complicated," he said. "I would likely have offered you a leadership position eventually based on your clinical performance, but the timeline would have been different. Learning about your military background prompted me to review your work here more carefully, and that review confirmed what Dr. Williams had already been telling me about your exceptional capabilities. So the timing was influenced by external factors, but the reasoning is based on 8 months of excellent nursing care." Chun absorbed this explanation with visible consideration, weighing Palmer's honesty against her determination to be recognized for her present work rather than her past credentials. "What specifically about my performance here makes you think I should be trauma team lead?" she asked, pushing Palmer to articulate the clinical basis for his offer rather than allowing assumptions about her combat experience to fill that space. Palmer consulted notes he had prepared specifically for this conversation. "Over the past 8 months, you have consistently demonstrated superior clinical judgment in high-pressure situations. Your documentation is meticulous and follows proper protocols without exception. Multiple attending physicians have commented on your teaching abilities with newer staff. Your response times during critical cases are faster than average while maintaining accuracy. During the mass casualty incident, you managed multiple critical patients simultaneously while coordinating team resources effectively. These are the performance indicators that justify the trauma team lead position, and they would be true regardless of what you did before joining our staff. Chun recognized the specificity of Palmer's assessment and appreciated that he had focused on observable behaviors rather than making vague references to her military background. She still had reservations about accepting a promotion that seemed connected to the investigation, but Palmer's reasoning addressed her primary concern about being defined by past service rather than current competence. "May I ask what the trauma team lead role would actually entail?" she said, signaling her willingness to seriously consider the offer if the responsibilities aligned with her professional goals. Palmer outlined the position's key elements, including oversight of emergency protocols, mentoring newer trauma nurses, coordinating with attending physicians on case management, and serving as the senior nursing authority during mass casualty events. The role carried administrative responsibilities that would reduce Chen's direct patient care time by approximately 20%, but Palmer emphasized that clinical work would remain the primary focus. The compensation increase was significant enough to matter, but not so dramatic that it suggested the position was being created specifically for her rather than filled by her. Chen listened to the complete description before asking her next question. Who was the previous trauma team lead, and why is the position currently vacant? The answer to this question would tell her whether Palmer was creating a role to accommodate her military background or genuinely filling an existing position that needed her clinical capabilities. Palmer appreciated the strategic nature of this question and provided a straightforward answer. Lieutenant Commander James Patterson held the position for 3 years before transferring to Naval Medical Center Portsmouth 4 months ago. We have been operating with Dr. Williams, informally coordinating trauma team activities since then, but she has her own attending physician responsibilities that prevent her from providing the dedicated leadership this role requires. We have been conducting a search for the right person to fill the position, and your performance makes you the strongest candidate we have identified. This answer satisfied Chen's concern about the position being artificially created. She remained silent for a moment, processing all the information Palmer had provided and considering whether accepting this offer aligned with her professional goals and personal principles. The trauma team lead role would give her more authority over emergency protocols and more influence in shaping how the department handled critical cases. Those were outcomes she genuinely wanted, independent of how the opportunity had arisen. "I will accept the position on one condition," Chun finally said. "The announcement to the staff and the formal position description must reference my clinical performance here over the past 8 months. No mention of my military background. No references to special operations experience, no acknowledgement of decorations or combat service. If this promotion is truly based on my current work, then that work should be sufficient justification without needing to explain where I developed those capabilities." Palmer immediately agreed to this condition, recognizing it as entirely reasonable and consistent with Chen's stated preferences. "The announcement will focus exclusively on your contributions to this hospital's emergency department and the clinical expertise you have demonstrated in your current role. Your military background will remain your private information to share or not share as you see fit." Chen nodded acceptance and shook Palmer's hand to formalize the agreement. She left his office feeling cautiously optimistic that this position might represent genuine recognition of her current competence rather than belated acknowledgement of her past service. The test would come in how the promotion was communicated to the staff and whether her colleagues understood the advancement as earned through present performance rather than granted because of discovered credentials. Dr. Williams received the news of Chen's acceptance with visible satisfaction and immediately began the transition process that would shift trauma team coordination responsibilities from her informal management to Chen's formal leadership. The attending physician had advocated for this promotion specifically because she believed Chen's clinical judgment and teaching abilities would benefit the entire emergency department. Williams understood that Chen's acceptance of the role represented trust that the offer was genuine rather than a symbolic gesture prompted by external pressure. The announcement went out to hospital staff 3 days later through the standard internal communication channels. The message identified Lieutenant Sarah Chun as the new trauma team lead based on her exceptional clinical performance, superior documentation practices, effective team coordination, and demonstrated leadership during critical cases over the past 8 months of service. No mention appeared of military decorations, special operations experience, or the incident that had prompted administrative review of her credentials. Chen's colleagues responded to the announcement with widespread support and several instances of genuine celebration that she would be taking a leadership role. The nurses who had worked alongside her during routine shifts understood her clinical capabilities firsthand and viewed the promotion as appropriate recognition of someone who consistently performed at a higher level than her position required. The lack of surprise in their reactions confirmed Palmer's assessment that Chun had been operating above her formal role since arriving at the hospital. Morrison learned of Chen's promotion through unofficial channels when one of his team members who was still receiving treatment at the hospital mentioned the new trauma team lead. The SEAL lieutenant felt complicated emotions about this news, recognizing that Chen's advancement represented positive resolution to a situation his actions had complicated. He had completed his mandatory training on inter-service respect and medical authority recognition, and he was scheduled to deliver his first presentation to basic underwater demolition training candidates the following week using his own failure as a teaching example. The letter of reprimand in Morrison's service record would follow him throughout his career, appearing in every fitness report and requiring explanation during promotion boards. He had accepted this consequence as appropriate given the magnitude of his failure, but he also understood that the documented mistake provided him with credibility when teaching others not to repeat similar errors. His presentation materials included specific details about dismissing Chen's medical authority and the cascade of realizations that had followed when he learned about her actual credentials and expertise. Commander Hayes reviewed Morrison's training presentation and approved it with minor suggestions for emphasizing the cultural assumptions underlying the incident rather than focusing solely on the individual failure. The presentation needed to convey that Morrison's mistake reflected broader patterns within the special operations community, patterns that would continue producing similar incidents unless addressed through sustained attention and institutional change. The goal was not to shame Morrison, but to use his experience as a catalyst for examining how the SEAL community recognized and respected diverse forms of expertise. 3 months after the incident, Morrison returned to Naval Medical Center San Diego for a routine follow-up appointment with one of his team members who was completing physical therapy for injuries sustained during the mass casualty event. The hospital felt different now, less like neutral territory and more like a place where Morrison had received an education about his own failures and the cultural assumptions that enabled them. He moved through the lobby with the awareness that his presence here carried weight beyond simple medical consultation. The physical therapy department occupied the second floor with large windows overlooking the emergency department entrance. Morrison waited in the observation area while his teammate completed exercises under a therapist's supervision, and from his elevated position, he could see through the windows into one of the trauma bays where a medical team was responding to what appeared to be a significant case. He recognized Chun immediately despite the distance, her movements efficient and purposeful as she coordinated multiple personnel around a critical patient. Morrison watched her lead the trauma team with the same competence he had witnessed 3 months earlier, but now her authority was formalized through the trauma team lead position rather than exercised despite his interference. The younger nurses clearly deferred to her judgment, and the attending physician consulted with her as an equal partner in patient management. Chen's hands moved with practiced precision through procedures that Morrison now understood represented capabilities developed through years of combat medicine experience, though her current team likely knew nothing about that background. The case resolved after approximately 20 minutes, and Chen stepped away from the patient to document the intervention while other staff managed the post-stabilization transfer. Morrison felt an unexpected impulse to go down to the emergency department and speak with her, though he was not certain what he would say beyond acknowledging that she appeared to have found the professional respect she had sought when leaving special operations. His teammate completed physical therapy before Morrison could act on that impulse, and they departed the hospital without Morrison making contact with Chun. 2 weeks later, Morrison delivered his training presentation to a class of basic underwater demolition candidates at Naval Special Warfare Center. The classroom held 40 prospective SEALs who were midway through their qualification pipeline, young men who had already survived the physical rigors of training but had not yet developed the professional judgment that would define their operational effectiveness. Morrison stood before them in uniform with a letter of reprimand in his service record and the knowledge that his documented failure gave him credibility to teach this particular lesson. He began by describing the mass casualty incident without initially mentioning his own role in it. The candidates listened with the focused attention that trauma scenarios commanded, recognizing that the lessons from emergency medical situations could apply directly to their future operations. Morrison detailed the critical injuries, the time pressure, and the life-saving interventions that had stabilized 6 casualties who should have died based on the severity of their wounds. Then he shifted to his own actions during the incident, describing how he had dismissed the primary nurse's authority and interfered with her emergency care based on assumptions about her competence. The classroom atmosphere changed as the candidates realized their instructor was confessing a significant professional failure rather than presenting a hypothetical scenario. Morrison explained the cascade of realizations that had followed, from recognizing her combat medicine techniques to learning she was a Navy Cross recipient who had saved 23 Marines during a 4-hour firefight while wounded. The lesson is not that you should respect people only after learning about their impressive credentials, Morrison told the candidates. The lesson is that expertise does not always look the way you expect it to look. I dismissed someone's medical authority because she was a nurse rather than a doctor, and because she was female rather than male. Those assumptions were wrong on multiple levels, and they endanger my teammates by delaying life-saving care. If you carry similar assumptions into operational environments, you will make mistakes that cost lives. Morrison continued the presentation for another 30 minutes, addressing the specific cultural patterns that had enabled his failure and the institutional changes being implemented to prevent similar incidents. He emphasized that respecting diverse forms of expertise required conscious effort to examine assumptions and judge people based on observable performance rather than predetermined categories. The candidates asked thoughtful questions that suggested the lesson was landing effectively, and Morrison felt confident that at least some of them would remember this training when facing similar situations in their own careers. Commander Hayes attended Morrison's presentation and was satisfied that the lieutenant had translated his personal failure into effective teaching that would benefit future operators. The institutional changes Hayes had proposed were progressing through Naval Special Warfare Command's approval process, with implementation expected within the next 6 months. The medical credential briefing protocol had already been adopted as standard practice whenever SEAL teams interfaced with hospital facilities, ensuring operators understood the expertise levels of personnel providing their care. At Naval Medical Center San Diego, Chen had been serving as trauma team lead for 2 months and had established herself as an effective leader who balanced clinical excellence with supportive mentorship of newer staff. Her colleagues respected her judgment and sought her guidance on complex cases, creating exactly the professional environment she had hoped to find when leaving special operations. The incident with Morrison's team had become a footnote in her employment history rather than a defining moment, mentioned occasionally when discussing protocol improvements but not treated as her primary credential. Dr. Williams observed Chen's leadership during a particularly complex mass casualty event involving multiple vehicle accident victims and felt satisfaction at how well the promotion had worked out for both Chen and the hospital. The younger nurse coordinated 8 different trauma bays simultaneously while maintaining calm authority that kept the entire department functioning efficiently under pressure. Williams recognized that Chun was operating at a level that would qualify her for leadership positions at much larger facilities, though she suspected Chun valued the current role precisely because it did not demand constant career advancement or recognition. The Navy implemented the gender bias awareness training that Commander Hayes had recommended, incorporating the incident involving Chun as a case study alongside other examples of how assumptions about competence could undermine operational effectiveness. The training emphasized that diversity in special operations required more than simply allowing qualified individuals to serve. It required creating environments where their expertise was recognized and respected regardless of whether it matched traditional expectations. The cultural change this training attempted to create would take years to fully implement, but the institutional commitment represented progress toward addressing systemic issues that had driven talented people away from roles where their capabilities were most needed. Morrison completed his mandatory training and resumed normal operational duties with his SEAL team, carrying the letter of reprimand in his record and the knowledge that his documented failure had become a teaching tool for the broader community. He occasionally saw Chun from a distance when visiting the hospital for various medical appointments, and each time he was struck by how she had found professional respect on her own terms rather than by leveraging credentials she clearly preferred to keep private. The incident had taught Morrison that expertise deserved recognition based on demonstrated performance rather than predetermined assumptions, a lesson that extended far beyond emergency medical situations into every aspect of professional judgment. Chun continued her work as trauma team lead, saving lives regularly and training the next generation of emergency nurses without needing to reference her military background to establish authority. She had achieved what she sought when leaving special operations, a professional role where her current competence spoke for itself and her colleagues respected her judgment without requiring proof of past achievements. The decorations in her service record remained part of her history, but not the definition of her present identity, exactly as she had intended when choosing nursing over continuing in combat medicine. What part of this story resonated with you the most? Have you ever had to prove yourself repeatedly in professional settings, or witness someone else face similar challenges? Share your thoughts in the comments below, and let me know if these kinds of stories about respect, recognition, and overcoming assumptions connect with your own experiences.